we're going to talk about ligaments, okay? Quick reminder, ligaments connect two bones together, okay? They're kind of the glue that keeps them together instead of floating around, okay? So we're going to talk about the ligaments in our ankle. First one we're going to talk about are the lateral ligaments, okay? So everything that's on the lateral side of the foot, okay? Big key with ligaments, they are usually somehow related to the bones. The names of them are usually related to the bones that they are connecting. So this is where I said in class, if you don't know the names of your bones, you're going to struggle, okay? So the first one that we have is anterior talofibular ligament, okay? We already know anterior means in front, and talofibular looks like the talus and the fibula, okay? Talus and fibula. So looking down here at our picture, we have, this is the anterior side of the body. We've got the talus down here and the fibula right here. And where those two bones are connecting, there is a ligament, okay? The anterior talofibular ligament is the main one that we see with ankle sprains. Okay, we see that foot is having an inversion sprain, which we'll talk about in a few minutes. It's the main one that we see injured. Okay, the next one is the posterior talofibular ligament. So still referring to the talus and the fibula, but it's just talking about on the posterior side of the body. Okay, still have the fibula here. We still have the talus here, and where those two ligaments are connecting, or where those two bones are connecting, there is the ligament, posterior talofibular. Next one that we see, calcaneofibular ligament, calcaneus and fibula. You can see that if it is a lateral ligament, it's got that fibula involved because the fibula is on the lateral side. Knowing where your bones are is going to help you tremendously, okay? Because if you see something that says tibia, that is not going to be a lateral ligament. So we have our calcaneus right here, fibula right here, and where those bones are touching is where that ligament lies, okay? I also have on here that Achilles tendon. Yes, it's a tendon, not a ligament, okay? And that's just back here coming off from the calcaneus. You can see it right here as it attaches to our gastroc. That's just so you guys can see that and know where that's connecting, okay? But these are some of the ligaments that I need you guys to know on the lateral side of the ankle, okay? Remember, fibula, lateral side, okay? The next, we will talk about the group that's on the medial side. Okay, the medial side ligaments are a whole lot stronger because they're a group. Okay, they're kind of all connected, and so because of that, that means that we have less chance that there's an injury to these ligaments because they are that much stronger. Okay, this group of ligaments are known as the deltoid ligaments. Okay, and usually if we have an injury here to these, it's because we've had an eversion ankle sprain. Our foot was injured in the eversion position, and we already know that our anatomy doesn't allow us to move a whole lot in eversion, so usually it's going to be a little bit more significant injury if there's an injury there, okay? So I really just need you guys to understand that the medial ligaments are the deltoid ligaments, but I do have listed here the ligaments that make up these this group, because I want you guys to make sure you're practicing looking at the name of the ligament and figuring out what two bones are connecting. So we have the anterior tibio-talar, tibia, and that talus. Again, you will see it all over the place. It's a very important bone, and it's on the anterior side of the foot, just like we had our anterior talofibular. Okay, on the opposite side, we've got the posterior tibio-talar, okay, because it's on the tibia, medial side. Then we have the tibio-navicular down here at the navicular, and it's connecting all the way up to the tibia, all right, and tibio-calcaneal. Here's our heel, There's the ligament that's connecting it to the tibia, okay? Keep in mind, that's the job. That little band that's going to hold those two bones together, all right? And that's going to be important because ligaments are one of the things that we see a lot of injuries with when we see in athletics, okay? It's just that those little rubber bands pop, okay? So our next little section, we're going to start talking about some prevention, okay? What are some things we can do? Obviously, dealing with your foot, ankle, and lower leg, the type of shoes that you're wearing is half the battle, okay? When you're having foot, ankle, arch related problems and you're not wearing appropriate shoes, you're not helping yourself out by any means, okay? Obviously, there's taping and bracing and that kind of stuff that you can wear as preventative. Depending on what your sport is, you're going to have extra protection, like if you're a catcher in baseball or softball and you've got shin protectors, shin guards on, or if you're in soccer and you have your shin guards on, there's going to be a little modifications there, but obviously any type of protection is going to help. The big component that we'll see is proper strength and conditioning. In our ankles, making sure that your muscles are ready for your activity, making sure that your body can handle whatever whatever activity you're about to have. And obviously, if you do have an injury, making sure that you do rehab exercises to make it better, all right? So we're going to finish up today with a little bit of ligament injuries in our body, okay? So I've listed a few. We're going to talk about them. Today we're going to just talk about our ligament injuries, and then tomorrow we'll pick up with muscles and our tendons. The first one that we have is a hallux sprain, okay? We're going to see the word sprain a lot. Sprain is referring to the ligament, okay? Sprain means that is a ligament injury, not a muscle, not a tendon, not a bone, okay? Hallux is talking about that big toe. We've already talked about that, all right? And we see this a lot when our foot is either forced into flexion, like if we're going and we're kicking a ball and our toe gets pushed underneath, or we're running and we kind of stub our toe, or it can be forced into extension, okay? Like if you're walking and you miss the step and your toe gets pushed up, okay? This is where we hear turf toe, okay? Turf toe is a hallux sprain. So our signs and symptoms, there's going to be pain depending on how bad the injury is. There could be some swelling or some bruising, all right? It's usually not that severe of an injury, okay? It's going to be more just uncomfortable. And our treatment for it is going to be the Price method. Remember, protect the area, rest the area, ice the area, have a compression wrap, and elevate. All right, that's our Price method. And there's some certain taping and wrapping techniques that you can do when you are able to play again. All right, this is why they call it turf toe. Okay, this is our little picture of our toe. Our football player right here, is being forced into hyperextension, and the ligament right here that is connecting those two bones is being overstretched, and that's where those fibers tear, okay? So this is a turf toe. Very, very common. We see this a lot, especially in soccer and football. So our next one is an arch sprain, okay? Again, we're dealing with the ligaments, okay? We get the arch sprains when we have a lot of running on hard surfaces, okay? Our body doesn't do well. It likes the cushion. It likes to be able to have that weight dissipate and spread out across the body. But when either we're not wearing the right shoes or we're on the hard surfaces, our body just kind of has to take that pressure a little bit more than it normally would. You're gonna signs and symptoms. There's going to be a lot of pain in the arch area. You're going to have discomfort when you're walking or running because your body's kind of used and abused at that point. There could be some swelling and some discoloration along that arch on the bottom of your foot. All right, your arch might be a little puffier than normal. The biggest thing that we can do with this is, again, that Price method. There's certain pads that you can put in your shoes to help give you a little bit more cushion. You can stop running on the hard surfaces and change your surface or get better shoes, but it's not usually too severe of an injury. So here's showing right here in the picture just where we would see the swelling, or that's where the pain would be occurring. So our next two are going to be the most common that we see. We have lateral and medial ankle sprains, okay? So a lateral ankle sprain, meaning that's where it hurts on the lateral side, is going to be when their foot is forced into inversion, all right? So that toe gets pushed in towards the midline, and we see that a lot, all right? It's very, very common. It's actually 85% of all ankle sprains occur in that forced inversion, okay? On the opposite side of that, if you are forced into eversion, okay, you would have those sprain of those ligaments on the medial side, okay, and that's only going to account for about 15%. Again, because those deltoid ligaments are so strong that they can hold things better, and just our general anatomy, okay. So with ankle sprains, you can see an ankle sprain that is so severe that there's lots of bruising, lots of swelling, they can hardly walk. And then there's just like you guys say you tweaked your ankle, okay? Still an ankle sprain, but just not as bad, all right? So there's a lot of differences here. So some signs and symptoms: swelling, the discoloration, all right? Some decreased range of motion. Maybe they hurt to do either plantar flexion or dorsiflexion or that inversion or eversion. Their strength might be decreased as well, usually from pain, okay? And sometimes you can see the ligament laxity, and what that means is that rubber band ligament is stretched so far that it's not really holding together anymore, okay? It's like your girls in your hair ties. You use them so much, and then you have to wrap them around like 5 times before they are able to hold that ponytail again, all right? Our treatment for this: we're still sticking with that Price method. There's bracing and taping when you are playing. But big things that we want to look at: if you feel that crunching feeling, not like a pop, okay, but you have that crunching sensation, that crepitus, that would be an indication for x-rays, as well as if you feel any what we would call a bony deformity, something that kind of feels like it's in the wrong place, or if there's instant swelling, okay? That could mean a lot of things, but those are some of those indications for checking for a fracture. Here's a couple pictures. We have a grade 1 ankle sprain where just a few fibers are torn. Remember, every ligament is made up of millions of fibers, okay? So with a grade 1, just a few fibers are torn. It's painful, but you're fine, okay? It'll heal. Grade 2 is a few more fibers are torn, so that is still connected, but it's going to be more painful, more swelling, that kind of stuff. And grade 3 is a complete tear, and that's what's shown here. You can see where these fibers are completely separated, and instead of that ligament being all nice and connected, it is not, okay? That's going to be a complete rupture of those ligaments, a lot more severe, okay, a lot more swelling. Our next one is ankle dislocations, okay? These are not common, thankfully, but definitely do happen quite a bit. They can occur where the ankle is forced anterior, and where the ankle is forced posterior, okay? And this has to do with that talus bone, okay? And we'll talk about this in class. This is an obvious deformity, okay? You can look at the ankle and you can tell that it is not, doesn't look like the other one, doesn't look normal, all right? The athlete will be in a lot of pain, and there will be lots of swelling quickly. It usually takes quite a bit of force to dislocate your ankle, okay? So your treatment for this would be activate EMS, splint that area as best that you can. Make sure that there's still, you don't cut off circulation, and that they can still have the nerve fibers active, but you do need to get them to the hospital immediately. And here's our picture. His leg should not be pointing in this direction, okay? His ankle is dislocated. Okay. So our next, we have one last one I'm going to get through quickly, is our high ankle sprain. Same thing as our other sprains. We're just dealing more with the tibia and fibula instead